In this daily run of responsibilities, fast-pacing life, hectic life, we hardly get time to take care of our health and ultimately falling into the trap of chronic illness like hypertension, blood sugar, diabetes, overweight or losing weight, or maybe PCOS, a lot of mental issues, and ultimately running behind the doctors, spending our hard-earned money on many of the medications which have a lot of side effects. So we should actually get twice a year a medical checkup done so that to track our health. But what checkups should we get done? We hardly know about this thing. So in this episode I am going to tell you about some basic tests which you should get done twice a year so that to track your health status. Number one, get a complete hemogram tested. That will include all that infection markers like the basophils, the eosinophils, the lymphocytes, the monocytes, the neutrophils and all. Then it will also include your RBC count. It will also include your hemoglobin levels and all. Then diabetes should be checked, like the HbA1c, your average blood glucose, your fasting blood glucose, and insulin fasting, which is very important. Then also include iron levels, the ferritin levels, ferritin being the storehouse of the iron. Then liver profile, the SGOT, the SGPT, your bilirubin levels, your alkaline phosphatase level, your total protein level, the serum globulin, which is very important for checking whether the body is able to detoxify itself or not, because the liver is the organ which is responsible for detoxifying the body. After that, kidney function test. This includes your creatinine serum levels. It includes your uric acid, the urea levels, the calcium levels, the BUN level, that is the blood urea nitrogen levels. It will also tell you about the urine albumin creatinine ratios. All these are important to check whether the body is having any dehydration, whether the kidney is functioning properly or not. Also, it tells you about the low protein in your overall body. Then get your lipid profile tested, which will include your total cholesterol, your HDL, which is a good cholesterol, then LDL cholesterol, non-HDL, VLDL, triglycerides. So this is important to assess your heart functioning, whether you are at any risk of arteriosclerosis, any heart strokes, any heart diseases or not. Then vitamin profile is very much needed. Vitamin B1, B2, B3, B6, B5, B9. It is very important to assess that because they act as a raw material for the body, which the body cells use to release energy. Then it is important to check for the thyroid profile. Thyroid profile doesn't include just the thyroid stimulating hormone TSH level, but you should also get it checked the T3 and the T4 level because they are the elements of the thyroid gland. Then if you are a female and having a lot of hormonal issues and you are not getting periods on time, or you are maybe getting a lot of fatigue or mental stress, you're getting a lot of anxiety or panic attacks, all these signs show a lot of hormonal imbalances taking place in the female. So in such a condition, you can get your hormone profile tested, and along with that, electrolyte balances like sodium and potassium levels in the body. And after that, some inflammation markers like the ANA, ACCP, homocysteine, these should also be tested to check what is the inflammation level of the body. So these are some basic testing which I think and I recommend my patients to be tested after every 6 months, so that we can check the health status of the body, where the body is going on the basis of this, and also on the basis of a lot of symptoms and the history taken by the patient, we can recommend any further testing if needed, or otherwise these things can also work as a basis for your treatment planning to be done and to find out the root cause of your problem. Hope this helps. Please get your tested twice a year after every 6 months, and please take care of your health. This is Dr. Aparna signing off. Please share with your friends and family, and please subscribe to our channel Tea Time and Gossip with me, Dr. Aparna.